Have you ever been confused about the difference between COVID-19, the flu, and a typical cold? Many have been perplexed by this subject because of the overlap in their symptoms. These three viruses cause symptoms similar to each other, such as coughing, sore throats, and sneezing, but understanding the subtle differences is vital not just for effective treatment, but also for prevention. You might be surprised to know that all three viruses share some common symptoms, making it quite a challenge to tell them apart. First, let's unravel the symptoms. While all three can cause respiratory issues, there are key differences we need to take note of. The common cold, flu, and COVID-19 all spread through respiratory droplets and can cause sneezing, runny or stuffy nose, sore throat, and cough. Yet, their severity and timeline vary significantly. The common cold typically lasts for about a week, with mild symptoms that can include sneezing, a runny nose, and a sore throat. The flu, on the other hand, usually hits suddenly and can cause severe symptoms such as fever, chills, muscle aches, and fatigue. These symptoms can last for up to 2 weeks. Now, COVID-19 is a bit of a chameleon. It can produce no symptoms at all, or mild ones that resemble the flu. At times, it can even lead to a sudden loss of taste or smell. Notably, COVID-19 can be contagious even before symptoms appear, a trait not typically seen with the flu or the common cold. The timeline for COVID-19 is also unique. The virus can incubate for anywhere between 2 and 14 days before symptoms appear. And unlike the flu, where symptoms often hit all at once, COVID-19 symptoms can start mild and then worsen after a temporary improvement. Remember, COVID-19 can be contagious even before symptoms appear, unlike the flu and the common cold. Now that we've discussed the symptoms, let's delve into how these illnesses can be diagnosed and prevented. The flu, common cold, and COVID-19 can all be diagnosed using different tests. For the flu, a rapid antigen test is available, but it's not very accurate. A more precise test is available, but it takes 3 days to get the results. For COVID-19, the gold standard is the PCR test, which is highly accurate but can take some time to produce results. Rapid antigen tests and antibody tests are also available, but they may not be as accurate as the PCR test. When it comes to the common cold, there's no specific test. It's usually diagnosed based on symptoms and the process of elimination. If it's not the flu or COVID-19, it's likely a common cold. The importance of testing cannot be overstated. It's crucial in confirming the presence of the virus and helping to prevent its spread. If you're feeling ill or have been in contact with someone who has tested positive, it's vital to get tested. Vaccination is also key in prevention. Getting your flu shot this year is particularly important due to the ongoing COVID-19 pandemic. It's also essential to continue to follow COVID-19 prevention measures such as wearing a mask, practicing good hand hygiene, and maintaining social distancing. It's crucial to remember that symptoms alone cannot definitively diagnose the illness. When in doubt, always get tested. In short, there are important distinctions that can help us distinguish between COVID-19, the flu, and the common cold, even if they all have some similar symptoms. All of them are transmitted by respiratory droplets. But COVID-19 can spread even in the absence of symptoms. Severity and duration vary, with the common cold being the mildest and shortest. Testing remains our most reliable tool for accurate diagnosis. Remember, when in doubt, always seek medical advice and get tested. Stay safe, everyone.